my name is Hannah. I'm going to be your student nurse today. Can you verify your name and your date of birth for me?
My name is Jane Doe, and my date of birth is January 1st, 1986.
All right, and first of all, congratulations on the new baby.
Thank you.
Can you tell me if you're having any tenderness or pain in your breasts?
No, I'm fine.
Have you noticed any masses?
No.
And are you going to be breastfeeding?
No.
Okay. Well, are your nipples intact, or have you been experiencing dryness or anything like that?
Nope.
Okay. Well, at this point in the assessment, I would wash my hands again, don gloves, palpate her breast, make sure that there's no masses or anything like that. Okay. And could you lie back for me? I'm just going to feel your uterus. Before I start palpating anything, I'm going to listen to her bowel sounds. Alright, so bowel sounds are going to be most likely hypoactive because typically the mamas are in PO until they deliver. I would also listen to her breath sounds while I was there, make sure that there's nothing funky going on. To palpate her uterus, I'm going to put one hand at the level of about her pants line, and then I'm going to take my finger and find her belly button and go up and try to locate the top of that uterus. Okay, so typically we want the mama's uterus to be midline, firm, and it's going to be about at the level of the umbilicus. It might be one finger or two fingers below. You can sit up now. Have you had any trouble using the restroom?
No.
What about number 2?
No.
You haven't had any problems?
No.
Okay, and how are those stools? Are they formed or have you had diarrhea?
They're formed.
Okay. And then I would assess her lochia, which is bleeding. So have you had any heavy bleeding?
Not really heavy.
Okay, and when was the last time you changed your pad? Has it been within the last hour?
Yes.
Okay, so then I would look at the pad and see how much blood was on the pad because we measure within hours. We're going to want to see how much blood has saturated the pad every hour to make sure that there's no sign of hemorrhage or anything like that. Okay, and then if mama has an episiotomy, we're going to want to turn her over and look at that episiotomy. So, did you have an episiotomy with your birth?
No.
Okay, and so I wouldn't need to assess for any stitches or anything like that typically for an episiotomy site, but did you have any tearing?
Minimal.
Minimal tearing. So did the doctor give you any stitches?
No.
Okay, so I would want to assess that tear site, make sure that there's no signs of infection, that her perineal area is being kept clean, and that there's no risk of it getting infected. While I'm down below the belt, I'll go ahead and assess, see if she has any hemorrhoids, see if there's anything else we can do for her down in that region. I will also want to assess her extremities to make sure her capillary refill is good in her fingertips, that blood flow is good. I'm going to want to assess her legs, make sure that there's no sign of DVT such as warmness or any palpable masses in her legs. That would give us a sign that she has a blood clot. I'll also want to check the capillary refill in her toes, make sure that all of her vasculature seems to be working in a proper manner. Mama's going to want to get up and walk around after birth to get everything, all the blood flowing after she's been through such a laborious time. And then we're also going to want to assess the mom's emotions. So how are you feeling? Are you excited about the new baby?
Yeah, I'm really excited.
Are you having any feelings of sadness or
No.
anything like that?
No, everything's fine.
Okay, so mama seems to be in perfect condition, and that's pretty much all you would do. Just make sure before you start any of the assessment to get their vital signs and to ask them their pain level on a 1 to 10 scale.